Hello everyone, welcome to my YouTube channel. The last part of the question that was sent regarding this question on American Society for Clinical Pathology exam is what I want to complete now. That's the last question. So this one is a little bit different from general hematology and blood transfusion question. This is, kind of different, okay? This one is looking at serum magnesium level, okay? So let's, before we get into that, my name is Dr. Emmanuel Ogbodo. I'm a biomedical scientist, and I'm also a lecturer in biomedical science here in the United Kingdom. So let's look at that. Now, we are going to look at, first of all, what is a Now, this is not the question, it's just the question that was asked is important that I talk about this, okay? So we're going to look at preeclampsia, okay? Preeclampsia. So in this very preeclampsia, one of the things you need to know that this is commonly seen in pregnancy complication, okay? So it's commonly with women who are pregnant, okay? And this can be commonly seen after 12 weeks of gestational period, okay? And then what it means is that once this kind of condition happens, okay, this complication happens, this person is going to have a high blood pressure, which is hypertension, okay? And what is going to happen is that will lead to a damage in the vital organs like liver, kidney, okay? And many other, as the case may be, okay? So now, when we don't treat this very complication now, it can now lead to what? Eclampsia. Pre means before, okay? Before. So eclampsia means it has not happened. So when there is a pre-eclampsia, when you begin to notice there are likely symptoms that suggest that if you don't do something about this pregnancy woman, okay, that this person may develop eclampsia. So that complication that you might see maybe after 12 weeks of gestational period that may be suggestive that if you don't do something about it, it may lead to eclampsia is what we call preeclampsia, okay? So when we don't treat it, when you don't do something about it, then it can now lead to what? Eclampsia. And when that happens, it's characterized, it's commonly known because it's going to lead to seizures. So that pregnant woman will start having seizures, and that obviously will not be nice, okay? Now, what are the risk factors? First of all, maybe it's a first-timer pregnancy, okay? First-time pregnancy, okay, that can be the risk factor. Sometimes it could be multiple pregnancy, like someone have twins or triplet or quadruplet, as the case may be, okay? So that can lead to that. And of course, obesity may also consider maybe one of the reasons. And of course, chronic hypertension, like maybe in a case of kidney disease, can also contribute to that. So these just few things that I want to mention. I'm not trying to teach this. I'm only mentioning this because it's going to be necessary on the question that has been asked, this person that sent me this question, okay? Right, so here is their question. Sorry, the images may not be clear because of the person sent it to me. I don't want to edit it. I just want to put it exactly the way the person sent it to me, okay? So I think this is a 98 question now. So they say serum magnesium level should be closely monitored in what? So A, preeclampsia, 2, eclampsia, 3, MI, okay? That's myocardial infarction, and D, which is AOTA, which is all of the above, as the case may be, okay? So let's look at what that means, okay? Now, I've already mentioned that this is myocardial infarction, okay? And this is all of the above. Just to make us to understand, I've already explained preeclampsia. I've said that is a complication. If you don't do something about that, that has to do with a pregnant woman. If you don't do something about it, what is going to happen is going to lead to that very eclampsia. And once you get to that eclampsia, obviously there's going to be seizure, and you don't want that to happen because then at that point there are damages maybe at the liver, kidney, as the case may be. So that's not very good. Now, let's look at eclampsia in terms of, preeclampsia, okay? Now, you're going to see that magnesium sulfate is very, very important because we are looking at magnesium here, by the way, okay? Magnesium is so vital in this thing, okay? Why is it so vital? It's vital because when we use magnesium sulfate, to prevent this very seizure. I told you that with preeclampsia, you need to do something to prevent the eclampsia from, I keep saying eclampsia, to prevent the eclampsia from happening, okay? So we do something to prevent the condition from developing from preeclampsia to eclampsia, okay? So because of that, one of the ways we can use to prevent this very eclampsia is by giving magnesium sulfate. So magnesium sulfate is used to prevent seizure. But again, if it is used to prevent seizure, in a case of that very preeclampsia, you don't want it to develop to what? Eclampsia, okay? because you are giving magnesium sulfate to prevent that, it's also important you monitor the level of that very magnesium. That way, you prevent the possibility of toxicity that may be associated with this very magnesium sulfate. This is like what we have in blood bank, or rather, I would say in hematology. And when we give a patient maybe anticoagulant, like maybe warfarin or heparin, you need to monitor it, because if you don't monitor it, even though it is helpful, it can be very, very dangerous, okay, if not monitored. So we still monitor magnesium sulfate level even at pre-eclampsia. Why is preventing the thing from the condition from developing to what? Eclampsia. We still monitor the magnesium there. So that means we can still use it to monitor magnesium. That means magnesium level can still be monitored using pre-eclampsia. That's what I'm trying to say here, okay? We are monitoring it to make sure that it will prevent toxicity that will occur, because we know that that magnesium sulfate will help to prevent the seizure, will help to prevent eclampsia. However, we need to monitor the level of the magnesium to ensure that while we are trying to prevent seizure, we are not going to allow the patient to experience toxicity due to high level of magnesium sulfate. Now, 2, which is that the eclampsia. Let's say the person, we didn't treat it, nothing, we didn't do anything about it, and the person has developed eclampsia now. One of the ways we can also treat this very eclampsia, one of the treatment choice is also by giving magnesium sulfate, okay? And that is one of the treatment choice there. And if that is the case again, we need to also monitor it. So we are monitoring it. Remember, you don't want toxicity, and we are doing it so that we can prevent possibility of respiratory depression or maybe cardiac arrest. So this, if we don't do something with this magnesium sulfate, it can affect the heart. It can affect the heart, and that's actually where myocardial infarction comes in. It can affect the heart, okay? In terms of the health of the heart, okay, can be compromised due to high level of what? Magnesium sulfate. So now, the final one being the C now, which is myocardial infarction. You can see the following of the order. The first one is that we're supposed to prevent it by using magnesium sulfate. If we are preventing it, okay, because it's going to prevent the seizure, we still need to monitor it because of the toxicity that can be associated with it. Now, let's say eclampsia, meaning that this person has developed the seizure, this person has developed this very problem now, okay? So we can also, one of the treatment choice is what? Magnesium sulfate. Then we also monitor that magnesium sulfate to prevent any of this cardiac dysfunction, as the case may be, and that is where myocardial infarction comes in here. So magnesium sulfate again is used, it can be involved in a cardiac heart. That means it can be used to stabilize the heart rhythm. It can be used to stabilize the heart condition, okay? So monitoring the magnesium is also important when we are taking care of someone that have myocardial infarction. So now, if you look at this, you will see that whether pre-eclampsia, whether eclampsia, whether myocardial infarction, all of them can be used to monitor serum magnesium level. I hope that makes sense. So I'm sure that the answer is pretty much clear now, okay? So what is the answer? I'm sure you know that. The answer is that it is all the above, because whether it is pre-eclampsia, whether it is eclampsia, whether it is myocardial infarction, all of them, so magnesium sulfate play a significant role. In pre-eclampsia, it helps to prevent seizure. Then we still monitor it to make sure there's no toxicity. In eclampsia, is one of the treatment choice. Then we still monitor it to make sure that it doesn't lead to the high level of it that will not lead to what? Cardiac arrest or maybe respiratory depression. And of course, then of course, if there is a cardiac arrest or maybe there is a cardiac dysfunction or like myocardial infarction, as the case may be, then we can also use magnesium sulfate because it plays a major role in stabilizing the heart rhythm. But again, with that, we still need to monitor it to avoid toxicity. I hope that makes sense. So the answer is D, which is all the above. Happy days. Right. Let me know what you think about the video. Thank you so much for listening. Let me know if you have any question. Like I've said many times, if you do have experience and you think there's something I've missed, feel free to explain. It will help everybody there. We are all learning. Nobody is the monopoly of all knowledge. So feel free to contribute when you listen to this video. Your criticism is much, much welcome and appreciated. Okay, all right, so don't forget to like, share, subscribe. Subscribe is very, very important that you subscribe. All right, feel free as well to contact Too Good Consultant Limited. We are here to help, to support your interview, to support your academic, to support your career. Feel free to contact us, and thank you so much and I wish you all the best till I come back away again. Bye-bye.